So it was one of those great Saturday mornings. You get to sleep in. You have no commitments the rest of the day. Young man was on the way to the kitchen to get that second cup of coffee to drink in bed. And as he's walking back, kind of looking outside, he walks back in the bedroom, and his wife says, "Hey, come in the bathroom a minute. I want to show you something." And on the edge of the sink is a pregnancy strip, and it's positive, and she screams for joy, he screams for joy, and as you can imagine, they sit down with that second cup of coffee, and they talked about what just happened to their lives. Everything from, we're going to have a boy, we're going to have a girl, we're going to have twins, what would they be, what will their names be, how does this impact our lives, how are we going to do this with our jobs, when do we tell our friends, when do we tell our parents, all those kind of things you'd have in life. So Monday morning comes around, they call the obstetrician works them in that week, and they show up for their first appointment. And it's kind of that typical thing. They have to fill out 75 forms, many of them poorly copied, and they have to fill all this stuff out. They're ushered back into an exam room, weights, blood pressure, labs are drawn, an ultrasound is taken. All this information is put together, and they're brought back to a room, and a clinical staff person comes in, begins to review all this information that's in front of them and starts to talk to them and chatting about, what to expect. And as the person is looking at the information, suddenly goes quiet and says, "The doctor will be with you shortly." So the couple looked at each other kind of concerned, rightfully so, and they knew something was up. So a few minutes go by, seemed a lot longer than that. The obstetrician comes into the room and begins, do some introductions, some nice pleasantries, and then she pulls up the chair next to them and says, "I've been looking at your numbers, and I'm very concerned about your diagnosis." And the couple, again, very concerned, they look at one another, and they go, "Well, doctor, what is it?" And the doctor says, "Well, you are a 43604. That's your diagnosis, and that's extremely concerning." And they look at each other again, and the woman says to the doctor, "Well, doctor, that's our zip code." And the doctor says, "Exactly." So that may sound like a fictitious story, and that is a fictitious story, but in America, if you live in New Orleans, depending on what zip code you live in, and this could be literally blocks away, the life expectancy difference in New Orleans is 25 years. 25 years, depending on where you live in New Orleans. In Chicago, in Baltimore, in Las Vegas, it's around 15 years. Literally, the zip code that you were born in has a huge impact. In Washington, D.C., it's about 10 years. And what's interesting about that story, that is the American healthcare story. And we have a real problem with healthcare in America. So healthcare has evolved over the last 75 years. And we like to criticize healthcare and point fingers at it, and we should. We'd be the first to admit that. But it's a healthcare system that we as a country, we've talked a lot about country this morning, that we created. We created it over the last 75 years, and probably the last 15 presidents have said the number one problem is out-of-control healthcare costs, and nothing is in place today to change that, and so we have a problem. It started back 70-some years ago when, after World War II, people coming back from the war, we had all these advances. It's interesting to know how many things happened off world events. So we had all these medical advances during World War II. People came back with all this medical knowledge, and the government decided, let's put all these veterans back to work. So what did we do? We built 4,000, the equivalent of 4,000 50-bed hospitals across the United States with Hilburton dollars. And then we did some really nice things along the way. We passed Medicare and Medicaid to take care of people, but we perhaps didn't think of some of the consequences. So in the early days, if half of your patients were Medicare patients, they paid 50% of their bill. So if you built buildings, guess what? The government paid half the cost. If you were a physician and you were doing lots of things, guess what? You got paid more. If you get paid to do things, you do things. So we had this great system set up where you could send the bill off to the government and build massive facilities. You could generate work after work after work and be paid for it. And so we created a system that over the last few years has gotten progressively worse. And so we sit here today with a system that costs us over $3 trillion, 17.8% of our gross domestic product. It is on its way to 20%, a lot of that having to do with demographic changes and the aging of America. So it's going to be $5 trillion and 20% of the GDP. And I think most people would tell you nothing will change that, nothing at all. And we know the results. You know, the number one cause of personal bankruptcy in the United States is healthcare. Number one cause of seniors now causing bankruptcy, and the number of 85-year-olds filing bankruptcy is at an all-time high. Why? Because they're living longer, they retired too early, and healthcare costs are eating up all of their extra money. People are making decisions left and right about things to pay, can't affording healthcare, making choices about food or utilities or feeding their pets or other things in life, and having to think about healthcare. So we have this problem. So it's one thing if you're, got your value, but when we compare America to the other developed countries, our model doesn't really work. The third leading cause of death in America is a hospital stay. That's a problem. When you look at some of the graphics up there, we already talk about life expectancy, we talk about costs. When we compare how we do against other countries, even though we pay so much more, we get a lot less. And on every health metric, European countries do much better. Now, some of that, there's some nuances for that. We kill a lot more people with guns. We have a lot more traffic accidents, so some of the statistics are there. But really what's happened is we've created a healthcare system that is really not changing, nor do I see any path that it's going to change. And again, if you talk to legislators many times and you have this discussion, they go, yeah, we kind of know, and maybe when we hit a wall, we'll fix it. Well, I think we hit a wall a long time ago. What's interesting about the evolution of healthcare, and think about it from your own perspective, so you come into an office, you have a procedure, and you are prescribed a treatment, a surgery, drugs that can be incredibly expensive. And yet in healthcare, we never ask you, do you have food on your table? Can you actually afford this procedure? Do you, have a job? Are you a victim of domestic violence? And really what's happening, there's a movement in the United States to really begin to talk more about the social determinants of health. So when you look at your health as an individual, it is largely determined by where you grow up. Your zip code, many people call it your ZNA. It is more important than genetics, and it's more important than anything else we do in healthcare. And really, those determinants of life really have a profound impact. So in Ohio, for example, we are 38th for infant mortality for Caucasian babies, 38th. Babies dying in their first year of life. 49th, there's only one state worse, for African American babies dying in the first year of life. Yet, we have some of the best children's hospitals in the United States, some of the best healthcare in the United States, and we spend a lot of money in the state of Ohio, and it's just a great proxy for what happens in the United States. So why is that? Why would we be 49th for infant mortality for African American babies? And it's the social determinants of health. These social issues that impact people more than ever before. So when you look at the statistics again, you see 20% of your health is related to health care. And again, $3 trillion, on the way to $5 trillion for that piece. And all those other issues, including the social determinants of health, are critically more important to your health and well-being. And I think that makes sense to you. Hopefully you don't hang out in doctor's offices, you don't hang out in emergency rooms. And really it's all those other things in life. And yet in healthcare, we didn't train people to ask those questions. We didn't train management people to think about those things. And all we thought about was, as long as we take care of you inside of our walls, we have done our job. What happens after you leave? If you live in a box, if you don't have food, if you're a victim of domestic violence, if you have transportation problems, if all these other problems in life happen, hey, that's not our problem. In fact, we didn't even ask you about it. And so really, if you think about how our system evolved clinically, it really isn't very logical, and it doesn't make any sense. Now, what's interesting in the European countries, many of the developed countries spend the same amount of money that we do, but they spend about half what we do on clinical care. And they spend the other money on the social determinants of health. So, the idea, and this is not a popular idea in healthcare, don't get me wrong, is to flip the model, is to take the money that we put into medical care today and put it into the social determinants of health. Now, there is a massive industry in America that's built around medical care. Hospitals, health systems, physician groups, pharma, drug suppliers, medical equipment, and they are powerful people, and yet they are a big part of our economy. So how do we begin to make that transition over a period of time? How do we begin to ask organizations to stop doing some of the clinical things we do and begin to do some of the social things? And the good news is there's dialogues going on today to talk about those things. Actually, there are members of Congress talking about a commission that would be appointed to say, a non-traditional commission to say, well, let's change our model. Let's pick a date and time where we'll allow people to adjust accordingly. And let's change it to a much more social-based model, because when we look at all the factors of cost, what we're getting for our dollars, and really what impacts people's lives, we have just allowed a model to exist that really, really makes no sense. So this is this idea, and this is what a few organizations are looking at and a few people are doing. I will tell you, it's not necessarily a popular notion. If you ask people if they do social determinants of health, they go, oh, yeah, we do that. We support the farmer's market. We put banners in our cafeteria. And so, but the real idea here is to look at those 10 domains of social determinants. So today, we are screening for these 10 domains. And not everybody likes healthcare doing this. But really, when you start to look at these issues, food insecurity in this country, hunger as a health issue. 13% of households are food insecure. 19% of households with children are food insecure. 33% of single moms and children are food insecure. That means they miss 100 meals a month. So first, they miss 100 meals. And secondly, depending on what kind of income stream they have, the food that they may be buying, they may only be able to afford food that is not particularly good. So we did some work with some education around obesity, and what we found was not that we had a problem with education around nutrition. What we found is that kids were hungry, and we had this fundamental need to think about hunger as a health issue. So go back to the expectant mother, not eating right, a child not eating right, the development of a child malnourished, and think about what that does. And yet, we spend $3 trillion on health care, and we don't provide the basics of needs when it comes to food security. So again, a lot of organizations are beginning to screen for food insecurity, providing short-term food needs, providing food pharmacies, and beginning to start to address those issues. Employment is a critical issue. The best thing you can do for an individual, get them off to a healthy start, provide education, provide a path to a job that allows them to fulfill the things in life. And again, when we look at health and well-being, those things are important. So when you see people begin to do these things in healthcare, And people say, well, what in the heck? Why are you doing this stuff? And it's because those social determinants of health are critically important. So when you see people invest in economic development, when you see people doing things in hunger, when you see interest already, we've talked about pre-K and education and the importance of having a solid education. When you think about changing neighborhoods, if you, are interested, there are a lot of cities in America now where people are patting themselves on the back saying, look at this great city comeback. Whatever city you like, just Google A Tale of Two Cities, Toledo, or Tale of Two Cities, Detroit. And what you'll find out is that the downtowns are doing great, and people are all excited, but the neighborhoods, the health of the neighborhoods, are either static or they continue to go down. And the reason for that is clear. It is those social determinants of life. And those are the things, as we begin to look at them, we have to look at those collectively and also individually. Jim Collins wrote a great book, Good to Great. Many of you have read Good to Great. Probably studied it in school along the way. He wrote a better book called Good to Great in the Social Sectors. Took him a year to write Good to Great. Took him 3 years to write Good to Great in the Social Sectors, and I think it's 40 pages. And what he said in Good to Great in the Social Sectors was, I was wrong. Didn't say that, but that's kind of what he said. He said, I was wrong. It's not how much money you make. It's what kind of impact you make relative to your resources. So everybody here has different resources individually. You work in organizations that have different resources. We live in different communities that have different resources. But if we all make an impact relative to the resources that we have, and we all begin to think of our work in life, not business to business, but business to community or business to society, and we look at those goals, which people now are realizing is actual success for organizations, and we look at that as a community, and we look at that as trying to improve communities, really what we find in life is, as YouTube says, where you live should not decide whether you live or whether you die. Thank you very much.